Thank you everyone for joining. We'll just give another minute or so for attendees to join, and then we'll get started. Thank you everyone for joining. We'll get started in less than a minute here. Great. Welcome. We are delighted to have today's webinar on the opioid settlement funds to provide information, but also to encourage discussion from the attendees today. Thank you so much for making time to be with us, and to the American Psychiatric Association and American Academy of Addiction Psychiatry for the joint work to make this happen. I'm Smita Das. I'm an addiction psychiatrist and chair of the American Psychiatric Association's Council on Addiction Psychiatry. I'm honored to be joined today by our panelists, Tara Kunkel and Dr. Hope Solarnik. We can go to the next slide, please. And the slide after that. Fantastic. I'll go ahead and introduce our speakers and present a brief bio on them. Tara Kunkel has served as Executive Director of Rouleau Strategies since 2020. Before founding Rouleau Strategies, Tara served as a Senior Drug Policy Advisor at the U.S. Department of Justice, where she led the implementation of the Comprehensive Opioid Stimulant and Substance Abuse Program, or COSAP. Under Tara's leadership, that program grew from $27 million in 2017 to $187 million in 2019. Tara also served as a consultant for the National Center for States for more than 9 years, leading, managing, and evaluating projects at all points in the justice system, from diversion programs, pretrial supervision, courts, probation, and corrections. Tara is a former treatment court coordinator in Virginia and has completed statewide evaluations in Nebraska, Michigan, Virginia, and Arkansas. Tara received her master's in social work from Virginia Commonwealth University and a bachelor's degree in psychology from the University of Virginia. Our second speaker, Dr. Hope Solarnik, attended the Medical College of Pennsylvania. She began her training in internal medicine, but was drawn to psychiatry, completing her residency at Hahnemann Hospital. Dr. Solarnik currently serves as Director of Addiction Services and Medical Director of Opioid Treatment Program at the Corporal Michael J. Crescent's VA Medical Center. In addition, she served as forensic evaluator for the 1st Judicial District of Pennsylvania. Dr. Solarnik holds a faculty appointment at UPenn Department of Psychiatry. She's board certified in both psychiatry and addiction medicine through ABPM. She's a distinguished life fellow of the APA and a fellow of ASAM. Dr. Solarnik is an immediate past president of the Pennsylvania Psychiatric Society and is passionate about best practices for the treatment of substance use disorders and is a strong proponent of harm reduction. In the next slide, we'll go over some of the logistics for today. Since we only have a limited time together, we won't be able to get to all of the questions, but I strongly encourage you to ask the questions so we know what to cover in the future, and we'll do our best to try to do outreach to get your questions answered even after the webinar. All of the lines will be muted on this webinar, but we'll be monitoring those questions actively within the Q&A section. So we will first begin with our speaker, and I will pass it on to Tara to give an overview of the opioid settlements. Thank you, Tara.
Thank you so much. All right, well, let's go ahead and get into it. So I'm going to start out by giving us just an overview of the national settlements, which are actually a combination of a bunch of different lawsuits of manufacturers, distributors, marketers, and pharmacies. So I think we often, often think of one big name, maybe Purdue Pharma, but it's actually a combination of a bunch of different lawsuits, which total a little bit over $50 billion. Total, the payouts are going to occur over 18 years. And here's a chart that kind of gives you an idea of how the payouts are occurring. So one thing that can be really confusing for people is to try to figure out how much money is my state going to get, how much money is my community going to get, and part of the reason why it's confusing is some things are still undetermined. So Purdue, for example, is in bankruptcy. And so how things are going to get paid out is still murky. Same thing for some of the other companies. Some companies like Walmart, they made their payout all in 1 year. Some are paying out over 5 years. Some are paying out over 18 years. What this means at the community level, what this means at a state level is that there's a lot of money that's coming to states and to communities front-loaded. So it may mean that if you picked a community and you looked at their payout, it might mean for a suburban community, they might get $2 million for years 1, 2, and 3. And then if you looked out over 18 years, it trails off and gets smaller and smaller and smaller. And if you look at this chart, it kind of makes sense because everybody's paying out in the first couple of years and then they trail out. And so I wanted to just give an explanation of it's not even payouts over 18 years. So at the community level, when communities are thinking, what do I do with this money? It's about thinking, what can I front load my payments on? So I might be buying a building, or I might be investing in things that are really expensive in the first couple of years, and then thinking about the payments getting smaller out as we go out over the 18 years. In these settlements, there's something called Exhibit E in these lawsuits, which really guides how the money is going to be spent. And it's a really long list. Exhibit E is actually 15 pages long. So when people say, what can I use the money for? If you were to pull out Exhibit E and you can hop on your computer and you can find it easily, the long list, I'm going to give you kind of a big overview of some highlights, but feel free to Google it yourself. It's made up of some core strategies. That's part Schedule A of Exhibit E, and then some additional approved evidence-based or evidence-informed strategies that states and localities can use their opioid settlement for. And it's all the things you could imagine, and they fall into buckets of prevention and treatment, harm reduction, recovery support services. Some states have also published additional lists of priorities, so they didn't have to follow Schedule E exactly. States could pick things in particular that they wanted to also lift up above the rest. So let's take a look of what some things are in Exhibit E. So one of the things I think might be of interest to the membership are things around supporting workforce development. So there are things that you can use opioid settlement for to support kind of growing your workforce. So here are 3 of the bullet points relevant that you would find in Exhibit E that you could spend the money for. So you can fund fellowships for addiction medicine specialists to provide direct patient care, instructors, clinical researchers for treatment. You can offer scholarships. You could do reimbursement, so kind of tuition assistance or paying back for tuition or those kinds of things. So lots of things that states or localities could consider doing to grow the workforce around treatment support, which is exciting. Lots of opportunity to expand access to medication-assisted treatment or other opioid-related treatment. Huge emphasis in Exhibit E in this area. I'm not going to read everything to you. There's also a heavy emphasis on expanding treatment for neonatal abstinence syndrome, and they call out several highlights here in this space, as well as expanding telehealth and a whole continuum of services. And I want to say that if you were to look at states and how they've begun to sort of interpret this language, although the language tends to be in Exhibit E very opioid specific, as you look at how states have sort of further defined that, they tend to be much broader. So I really want to emphasize that they tend to have taken this opioid specific language and broadened it out to substance use more broadly. So I want you to really be thinking about that. And even I've seen several states even begin to use broader terms like co-occurring disorder. And I've seen states place a little bit more emphasis on that co-occurring substance use disorder. So I think sometimes states that have not been impacted as directly by opioids have said, oh, this is not for me, maybe not paid as much attention to kind of the settlements, but I really want to encourage you to really pay attention to this funding because it is much more broadly for substance use in general and also for co-occurring disorder. To also continue on with some additional examples to kind of think even more broadly, there's a focus on withdrawal management, which could include things like alcohol withdrawal, treating trauma, mobile interventions. I mentioned telehealth before, also peer recovery coaches, and then all of the broader recovery supports that we know that people in treatment need. So focusing on access to recovery housing, being able to fund things like move-in deposits, utility assistance, things like job placements, childcare when people are in treatment, peer support, kind of social supports, sober supports, all of those kinds of things are all things that can be funded. So there's, again, this is a 15-page list. I pulled out just some highlights as teasers to encourage you to understand that Exhibit E is broad. Also, harm reduction prevention services are all incorporated into Exhibit E. I'm pretty certain that if it is on your mind and you're feel free to drop anything into the Q&A that you're sort of curious about. And when the other speaker is speaking, I'm happy to sort of say yes and no, but I'm pretty sure that anything that you could dream up that might be on your mind is probably covered in Exhibit E. I haven't found many people in the planning process that have dreamt up something that might be on their minds that isn't covered in Exhibit E that is evidence informed. So it's an exciting opportunity that's available to people that are interested in supporting access to treatment and removing barriers. So if Exhibit E gave us kind of a map on what we could do, I wanted to just highlight how states and localities are actually taking this and moving forward with this. So I wanted to highlight that every state is going about this a little bit differently. So I picked North Carolina and Virginia and wanted to kind of give you some examples of what this is looking like, boots on the ground. So North Carolina is getting $750 million over 18 years. They put a heavy emphasis on getting the money down to counties and municipalities. So 85% is going to counties and municipalities, 15% is being kept by the state. So I love that. They gave a heavy focus on encouraging localities to spend time planning and focusing them on what they called high impact opioid abatement strategies, which was option A. And they focused on 100% public reporting. So they placed an emphasis on saying, we want you to tell the public what you're spending the money on. Not every state has focused on that. So there was no inherent requirement that you had to tell people what you were spending your abatement money on. So emphasis on county control, emphasis on transparency, emphasis on high impact strategies. Their high impact strategies were as follows. Criminal justice diversion programs, so moving people out of the criminal justice system, medication assisted treatment, reentry programs, recovery support services, there's kind of a list of 10 here, recovery housing support, employment-related services, early intervention programs for children and adolescents, evidence-based addiction, naloxone distribution, syringe services, and post-overdose programs. So the way it worked in North Carolina is if you picked a high-impact program, you could spend your money right away. If you wanted to do something that wasn't on that list of 10, you had to go through a planning process before you could access your money. So that was North Carolina's approach. Virginia, in contrast, 55% of their money was kept at the abatement authority, which was up at the state with a kind of a body. 30% went down to political subdivisions, so that's kind of your county level. 15% was kept by the state. So 55%, they basically kept in a more competitive approach and said, you got to apply for this money. I'm not just going to hand it to the counties. I want to sort of keep it as sort of some competitive situation with some thinking into it. And they created a gold standard policy That was, are you using it for things that we sort of are evidence-based is sort of the Virginia language. They also put an emphasis on that public reporting. So you see side by side, two states close together, they border one another, different thinking of how they went about spending their money. I've talked about states, but sometimes cities and counties sued the manufacturers and distributors or marketers. Jefferson County, Kentucky, or Louisville did their own lawsuit. This was how they went about it. They are getting $57 million in year one. That ended up being $7 million. They picked three things they prioritized: harm reduction, outreach to the Latino community, harm reduction within the homeless population, and extending the community supply of naloxone. So it is not just states giving out money. There are tons of lawsuits that occurred at the local level. They went through a similar sort of decision-making process and determined their own priorities and are doing their own decision-making of giving out their money. They created a public application process where they're giving out $5.3 million in sort of competitive applications. So I want to conclude by sort of giving you big picture of where there's variability so you can kind of find your state. This is as of June 2023, so some things have changed. And this will wrap up kind of our big picture overview. So the first question is, what states have advisory councils that decides how the funding is distributed? So 19 states have a non-binding recommendation approach to how the settlement dollars are being spent. 14 states have committees that directly disperse or award grants. So Virginia, earlier we saw that 55% were kept up at the abatement authority. So that Virginia is one of those 14 states where they're 55% of that money is being handed out by them. If you're kind of curious, if you looked nationally, who's on these advisory councils? Like, what's the composition nationally? So here you can see kind of the big picture distribution if you were to sort of look by position. Now, this can vary quite a lot if you were to go state by state. Other sort of curious things, 7 states decided to have representation from the recovery community on their advisory committee. So kind of looking at who was interested in having people directly impacted. I think there's often this impression that everybody's already handing out money and it's too late to be at the table and I can't impact anything that's going on and, I missed the boat. And that's really not true. As of June 2023, 17 states had announced spending priorities or spending decisions. 10 states had awarded settlement fundings as of June 2023. So really not that many. Again, there's this impression everybody's already done it, but really not at all. I think, Oklahoma, I think, is just now accepting applications. They extended the deadline, but it's really not too late in most states. And even some of these states like Virginia, I'm going to pick on, has only done one round of funding. They didn't award the funding for 18 years. They awarded it for one cycle. And even that cycle covered 3 years of funding. So not too late at all, even in these states, to get engaged. 5 states have created or published formal spending recommendations that were awaiting approval from the legislature. And 10 states have published annual reports related to their activities. So again, going to this transparency, how easy is it to find out what's going on? 10 states have published so far reports on their spending. 1 or 2 have some pretty decent dashboards out there. So going back to my workforce example, to kind of translate to who has made this real life example. So New York is an example that they have invested $3 million of their funding into a scholarship program. Now, they went at the bachelor's level to promote some workforce moving up, but here is an example of how a state is done. But if the language is there, it can be done. The challenge is getting involved and influencing how it's going to be done. And I know Hope is going to talk a lot about that. And I want to conclude with there's always this concern about problematic spending. How do we keep things from becoming problematic, or where has it already become problematic? So I want to just highlight 3 examples that have been well published in the media as I wrap up. So here's the first one. This occurred in one community where a county commission used their opioid settlement funding to pay regional jail fees. Again, we can debate whether this is right or wrong. I would say the media, at least from their perspective, and I would say many people who reacted to the story questioned the use of this. A second story that got a lot of media attention was a community that used $50,000 to buy a litter crew vehicle to drive individuals who were incarcerated to collect trash on the side of the road with their settlement money. And a third community used $63,000 of their settlement money, which is about 6.5% of their settlement money, to pay off employee health insurance premiums and cost of living adjustments, because they did not have that budgeted in their expenses. So these are three pretty well published examples of what was perceived by the media as some problematic examples. So this is starting to occur. And I'm sure we'll talk in the Q&A about how we what we do about this, how we get engaged, how we prevent this, and how we become involved. So I'm going to stop there sharing, and we're going to transition.
Fantastic. Thank you so much for that excellent overview and just the really detailed slides that sum up a complex area very, very well. And I love the preview for part of the discussion that we'll have. We're having great questions coming in, so please keep them coming. Dr. Solarnik kindly answered several in the chat already. Thank you for that. And now I will pass it over to Dr. Solarnik to do the next presentation.
Hello, good afternoon. I want to give my disclaimer, which I did not send to the APA. Although I work for the VA, nothing I say represents the VA or the views of the federal government. Thank you. It's so exciting to be with you to discuss this important topic, the opioid settlement. Next slide, please. The order of my talk is as follows: the magnitude of the problem and the magnitude of the settlement. The Pennsylvania settlement, I live in Pennsylvania and know a lot about it now after reading for many, many months. Principles to inform the Pennsylvania settlement, oversight of the settlement, and how to make your voice heard. Next slide, please. The stakes are high, as Tara so ably pointed out. It's more than $50 million, and with the recent Kroger settlement, maybe close to $57 billion. Next slide. The stakes are also high because of the ongoing overdose epidemic. In 2022, we saw almost 110,000 overdose deaths. That was a 1.7% increase from 2021, and unfortunately the highest number on record. More than 75,000 involved fentanyl or its derivatives, and racial disparities. They're so apparent now. In 2020, the overdose death rate increased by 44% in Blacks and 39% in American Indians and Alaskan Natives. We also know that a small percentage of patients with opioid use disorder actually receive the gold standard of care, which is medication for opioid use disorder. And we know that methadone and buprenorphine are preferred, but Vivitrol is also utilized. Again, that is not enough receiving treatment, as we know as psychiatrists. Next slide, please. This slide you can peruse at your leisure. It shows the efforts on the part of NIH to actually address the disparity issue. Next slide. And these are the stats from 2021. Notice the deaths were a little bit lower. What I want to point out is that the curve is flattening, which is the one piece of good news. There was a 30% increase in the number of deaths due to overdoses from 2019 to 2020, and a 15% increase from 2020 to 21. So again, that curve is flattening. That's a piece of good news. Next slide. Tara talked a lot about this. I'll touch on it briefly. This is a huge settlement. It involves manufacturers, distributors, retailers, mainly pharmacies. The big three that you'll hear about, and hopefully you'll read about after this presentation, McKesson, AmerisourceBergen, Cardinal Health, are the big three distributors. They, along with Johnson & Johnson, are part of the $26 billion settlement that is the first wave of settlement monies. Of that $26 billion, PA is to receive a little over $1 billion. Next slide, please. That settled in 2021, and payments have already been flowing. They flowed in 2022, and that was the first set of payments from the first wave. Pennsylvania, all 67 counties joined in the agreement. The monies from the big three are to be paid over 18 years. The monies from J&J, again, that's $5 billion, are to be paid over 9 years. 70% of the monies in Pennsylvania are going to counties. Again, we have 67 counties. 15% are going to local government and 15% to our Commonwealth, that's the state. Why, you ask, would 70% go to counties? Well, it's counties that do the drug and alcohol programming, right? If I am calling about a patient, I'm going to call the Department of Behavioral Health in Philadelphia County. Next slide, please. The second wave of monies settled in late 2022. It involved the efforts on the part of 18 state attorney generals, including the then Attorney General Josh Shapiro of Pennsylvania, who is now our governor. CVS and Walgreens will make up over $10 billion of that settlement. The CVS payments, as Tara said, over 10 years, Walgreens over 15 years. Other companies involved, I want to point out too, Walmart is paying most of their monies up front, and Mallinckrodt, as Tara said, is in their second wave of bankruptcy. They were due to pay $1.7 billion. It sounds like the court is going to reduce that to $0.7 billion, and they were unable to make their second payment. They did pay $450 million, correct, Tara? Yeah, thank you. Of those monies in the second wave, Pennsylvania will receive $450 million from CVS and Walgreens, and the payments should be starting now. Total monies, again, this is very, very, very big, over $54 billion, with Pennsylvania, when all is said and done, receiving over $2 billion. Next slide, please. So how did Pennsylvania determine which county would get what, right? We have 67 counties, some big, some small, and many rural. 20% of our population in Pennsylvania live in rural areas with low populations. So a team from Penn State, and this was fascinating to me, led by someone from their Center for Healthcare and Policy Research, along with a biobehavioral expert, I had to read about that, a criminal justice expert, 2 experts in engineering, and an expert in big data, got together and formed the team that created a formula for distribution of this money to Pennsylvania. And they were first looking at the first wave. So that first wave coming to Pennsylvania was 20 million. I'm sorry, 1 billion. Go on, please. So the formula they came up with was, in order to be transparent, they would look at public data only. In other words, they didn't search Medicare data, which can be private, or any other private data. They looked at the number of overdoses per county, the costs of any hospitalization associated with overdoses, and the amount of naloxone distributed per county. The final solution is based on those factors, with the final caveat that at least 1 million will be allotted for each county, no matter the size. Because they said if you give a county a few $100,000, they will not be able to implement any real change for folks with opioid use disorder in the context of this ongoing epidemic. Philadelphia County will receive the most money based on the formula from Penn State. Next slide, please. Principles for use of the opioid settlement funds. This is really, really important. This comes out of the Johns Hopkins School of Public Health. That's the Bloomberg School of Public Health. And it's based on ethical principles being applied to this huge amount of money. Number 1, spend money to save lives. Number 2, use evidence-based processes. Number 3, invest in youth prevention. Number 4, and pay attention to this one, focus on racial equality. Number 5, develop a fair and transparent process. Next slide, please. If you look at the biomedical principles that we practice from as psychiatrists and physicians, it's really very similar. Beneficence, doing what's best for the patient. Of course, we're going to apply this to patients who need services and do what's best for the patients. Non-maleficence. If we were going to spend the money inappropriately on bridges and infrastructure for our cities and counties, that would be inappropriate and indirectly harmful to the patients and the citizens who are suffering during this ongoing epidemic. Autonomy and informed consent, that involves the transparent process that is talked about in the Johns Hopkins Public School of Health. And justice, social justice, addressing at-risk youth who may be living in less than ideal conditions, addressing other populations that are suffering more, and addressing the rising overdose rate in underserved populations. Can you go back to the slide from Johns Hopkins? I just want to show that one more time. So again, spending money to save lives and using evidence-based treatments go along with beneficence. Investing in youth prevention and focus on racial equality go along with social justice. And developing a fair and transparent process goes along with truth-telling. Next slide, please. And great, thank you. Recommendations for the PA monies. In addition to the ethical constructs, which can be more vague and interpreted differently depending on who is interpreting them, there are actually concrete guardrails in place for the oversight of the Pennsylvania monies. There is a court mandated by the Commonwealth Court of Pennsylvania, a 13-member oversight committee for monies to counties and local governments. And I'll talk about that in a minute. There's Exhibit E that Tara talks so nicely about, opioid remediation core strategies, naloxone, MAT, NAS, ESPERT, and MAT for pregnant women, warm handoffs. So important. A patient has an overdose, they're brought to an emergency room, or they're dealing with EMS. There can be a peer support specialist immediately liaison with that person, even if they don't want treatment. Our carceral populations, they're suffering in Pennsylvania jails. In the past, MAT was not offered. So we had patients going through withdrawal and needing a maintenance medication such as bup and not able to receive it. That's changed a bit, but the cap on the buprenorphine dosage, believe it or not, is 8 milligrams. So everyone in our jails in Philadelphia and surrounding areas is getting Subutex 8 milligrams and no more. We're looking to change that. Prevention, safe syringe programs, and of course, data collection, so we can actually see what works and what does not work. And I want to point out that there is concern in the press, brought up by reporters and citizens, that monies will not flow according to the criteria listed above or to ethical principles, but will be diverted to law enforcement. We have a situation in one of our counties where they're receiving over the time period of 18 years, about 16 million. And what they plan to do and what's been approved is that they may spend $275,000 on their drug task force, which involves law enforcement. So I'm going to look more into that. I'm interested, but it has been approved. And that's something that will come up as Tara talked about. Next slide, please. The Oversight Committee for Pennsylvania has a long name, PA Opioid Misuse and Addiction Abatement Trust. We call it the PA Opioid Trust. And it has oversight over the monies. It has oversight as to how the monies will be spent. Interestingly, 2 of the members are appointed by the governor. So the director, who is an attorney and is the former chief legal counsel for Highmark Health, is one appointment by the governor. The second appointment by the governor is the secretary of Pennsylvania's Department of Drug and Alcohol Programs, known as DDAP. 11 other members from across the state, including 4 legislators, and they were appointed by legislative leads, 2 Republicans and 2 Democrats, and 2 county commissioners. Again, they have oversight as to how the money is distributed and how the money is used. And there is a reporting structure in place where the counties need to report on a yearly basis, although 2023 has been exempted from reporting how they're spending the money. If there is a conflict between the trust and the county, it then goes to Commonwealth Court for full resolution. Interesting process. Next slide, please. I want to look at the Philadelphia monies. Again, Philadelphia is the one county that's getting the largest portion of the money. It'll be $200 million over 18 years. And that's that first pool of money. There's more money coming in. So we're talking about that first pool. They received $20 million in the first year in 2022. And they have outlined their priorities. If anyone knows Philadelphia, you will know about Kensington. For those of you who don't know about Philadelphia and Kensington, it is an open air drug market. People live in encampments. People are using and injecting xylazine and fentanyl. And if you look on YouTube, you can see pictures of this area because people are kind of stooped over and frozen, which is one of the effects of xylazine. And it's very, very, very tragic. It's lots of people of all ages living in these conditions. Not only are the people using affected, but the neighborhoods, the communities where people reside and businesses try to flourish are affected. So that $7.5 million is so important to refurbish the Kensington area and take it from a state of unwellness to a state of health. I also want to point out $4 million for treatment, methadone, and wound vans. And I called my colleagues at the Department of Behavioral Health, and guess what? 2 methadone vans have already been implemented and 2 wound vans. And their next priority is the carceral population and raising the BUP cap in the prisons from 8 milligrams to 16 milligrams. $3.5 million to overdose prevention and community healing. $1.9 million has already been granted, 27 grants thus far. So Philadelphia is doing amazing work. I also want to mention that $2.75 million, and this dovetails with what Tara talked about, is also going to at-risk youth and Black women who are dealing with very high rates of maternal mortality in the first year post-pregnancy. So not exactly opioid use disorder, but certainly related to health of a community. Next slide, please. For the audience, we're dealing with a huge amount of money. You've heard from both of us the amount of this settlement. You've heard from both of us that this settlement will be available for many years to come, at least 18 years, perhaps more. We all know what happened with the tobacco settlement. It failed to help the people in need. It went to infrastructure in cities, counties, et cetera. We don't want that to happen again. So as an audience, I'd like you to think about what would you do to implement a successful and equitable program spanning 12 to 18 years. You really need to think like a brain trust. Next slide, please. And how can you get involved? Because this is so important. We have not had an opportunity like this in years and years. You can get involved locally or regionally. You can join your state or chapter psychiatric society. You can join your government relations committee. I'm a member and I am a proud member. You can work with your lobbyist. And if you don't have a lobbyist, you can work with the APA. They will help you so much to understand the issues, have proper talking points, and know how to talk to legislators. They'll give you an elevator type speech that you can use and memorize or not memorize. It's vital to get to know your local legislators. They need to know your voice, your face. They need to remember, oh, Dr. Solarnik talked to me about this last week. I think I'll reach out to her and see what she thinks. I'll see what the Psychiatric Society thinks about that issue. We actually testified before the Pennsylvania Department of Drug and Alcohol Programs on January the 18th, 2023, about the opioid settlement. And dovetailing with what Tara talked about, we asked for 10 additional addiction psychiatry slots and money to implement collaborative care, because we know those are two solutions to the workforce solution and to making inroads for the ongoing opioid epidemic. Make your voice heard. You can do it. Thank you.
Great. Thank you so much to both of our presenters for those excellent talks. And I totally agree with make your voice heard. You can do it. I think that there's so much that as individuals that we can do in our communities by connecting with our local legislators and so on. We've had excellent questions. Thank you to both of our speakers also for answering several of those questions throughout. I'm going to start with one here, and Hope, I'm going to start with you because you kind of alluded to some of this at the end of your talk there. But if my state or county is using funds in a way not related to substance use disorders, and you gave some excellent examples, what can I do to raise awareness or address the issue?
Number one, we have reporters in the state of Pennsylvania, one in particular, who's very, very savvy and will pick up any discrepancies related to the opioid settlement. So I read his material. I continue to educate myself, and hopefully we are educating all of you today. The other thing that's very vital is our trust in Pennsylvania that oversees the monies is subject to the Sunshine Law. And anything they do that requires a vote has to be done in public. They have 4 public meetings per year. And the more of us who attend, the more stakeholders who attend these meetings, the better.
Thank you. And Tara, you had some excellent examples at the end of your slide. Would love to hear from you on this as well.
Yeah, I mean, I think it's really important to get engaged in the process. I think there's a sense again that like we've all missed the boat. We haven't all missed the boat. You know, it's really just happening now. So I would really get families who've lost loved ones engaged. So in addition to getting the media engaged, I think there's very active voices of people who have lost loved ones, get the peer recovery community engaged and aware of these issues. I think those are very strong voices who also can raise awareness of why this money translates to lost lives. And I think those voices can be very powerful to speak to the state's attorney generals, who were the ones who filed lawsuits for the states. Or to whoever filed the lawsuit on behalf of the county, and to make sure that we don't lose track of why this money came about in the first place. And I think they can speak to that better than almost anyone. So I think just not losing track of that.
Thank you. We've had a number of questions around how this is state by state based, which both of you have talked about. But also, is there any coordination between states? Are there funds available for private multi-state providers? And finally, what about national organizations? How might these funds play into there? I'll start with you, Tara.
Yeah, so it is very state-based, and every state has a different process. So there's not like a different pot of money to fund national organizations. There's not like a reserve in that way. But where I have seen national organizations be effective is to do national education campaigns, and then to try to advocate within the state to get particular set-asides or support in each state to leverage whatever it is that they're advocating for, but there is not a separate pool of money that they can seek to support kind of national initiatives. So unfortunately, while they can educate at a national level, any kind of support funding initiatives they want to do, they do have to seek that funding in each and every state.
Hope, do you have any examples from Pennsylvania of some of the initiatives or work that might be able to have more national impact or be able to disseminate information to national audiences?
You know, I'm thinking we're all state psychiatric societies, and we have the government relations team at the APA. I'm thinking we could use that as our central nervous system and coordinate efforts. Again, as Tara said, these monies are flowing to states, and the money is not going to the national government for initiatives. If we think that some money should be available to some national pool that's maybe involving the Psychiatric Society or some other society, we'd really have to think about that, because that's not what's outlined in the criteria.
Yeah, it's interesting how sometimes these policies roll out state by state, and all the states are struggling with the, the same things in different ways. And so I love the idea of trying to have some way of coordinating. And this is an excellent question. I'll move on to another question that we have here. We're getting, well, this is related to multiple topics, but we're getting questions about how to advocate for funds that might go to certain treatment or even research of things not directly used to treat opioid use disorder or prevent overdose. Examples are using psychedelics as a treatment or using contingency management and so on. I would love to hear from both of you on thoughts that you have on that. We can start with Hope, who are unmuted already.
Sure. I'm a huge proponent of contingency management for stimulant use disorders, and it's an evidence-based treatment. I think that's something that could be taken up through the Psychiatric Society and then reaching out to the state. There are so many avenues to reach out to legislators. And again, the director of the drug and alcohol programming at the state level is a member of the oversight committee. So in reaching out to Pennsylvania's drug and alcohol department, we hopefully are able to get our voices heard and possibly get inroads to the oversight committee. And again, the oversight committee has public hearings. So I feel like there are lots of opportunities to ask for what we think would be evidence-based and helpful in the context of not just the opioid epidemic, but stimulant use disorders as well. And we know that people are dying from overdoses, not just due to stimulants, but stimulants that include fentanyl mixed in.
Yep. Thank you for that. And Tara, you did help to comment on one of the questions in the chat around this. What would you like to add?
Yeah, so I would say, again, it's not just opioids. Any kind of substance use is on the table. Contingency management is absolutely an area where funding could be directed. I did comment on the question around psychedelics and research in that space. Kentucky is considering directing some of their funding towards research in that space, and there's a lot of media articles around the conversation taking place around that allocation. So every state is definitely sort of taking its own path and considering different options around that. And I think engaging in those conversations at your state level is something I would encourage. And even if you're not an official appointed member of the committee, all of the committee meetings in every state that I've seen are open meetings. So lots of states have not even figured out their steering committee. So like West Virginia, I'm going to point out as an example, is just now determining their steering committee process. And there are states where they haven't even figured out their group. But if you happen to live in a state where it is already determined, that's still okay. You can participate in those meetings because of the nature of many of your professional backgrounds. I think your participation would be quite welcome. And you can attend those meetings, engage, contribute in the conversations. I've participated in other state meetings just by video. Not a lot of people attend. So attending, engaging in the conversations, offering information, I think your voices actually would be quite welcome.
That's very helpful. Just, knowing that there's not many people attending. I guess one of the questions that somebody might have that might contribute to low attendance is how does an individual find out about where those meetings are, how to attend?
Yeah. They're virtual, so you don't have to live in the state. So I would say, even if you're just sort of now mildly curious and you don't live near your capital of your state, I would say every state that I've ever Googled has a website devoted to this. It's usually sort of either an independent organization or it's under the Attorney General, but I have no doubt if you just Google your state, you'll find it. The meeting minutes are posted, and they usually post the links to their meetings. And in every state that I've seen, they tend to have virtual Zoom meetings or team meetings, and you can just pop on and watch the meetings. They typically also post the recordings of the meetings. So I will say, while there's not always transparency on how they're spending the money, their meetings do tend to be recorded. And so it's pretty easy to see what they're up to. And that is one way to become informed, is to watch those state meetings.
And if you look at the paopioidtrust.org, it lists all their minutes, which I've read.
Yeah.
And it lists their next meeting, which I believe is November the 30th. And I will be in attendance. And I hope that many of my colleagues will join me.
That's a great plug. Thank you for that. Terry, you did mention, there's not always transparency on how the money is spent. Are there transparency requirements for how it's being used at the state and local levels?
Every state has a different process. Some states did build into their process transparency. Hope, I think you said yours does require that transparency. Virginia's been really good about that. That happens to be where I live. Other states, no. You have to go state by state. One of my slides had whether you live in a state where it's required or not. Some have very good dashboards where you can look up exactly what is going on. But there are states where it's not required. So each state got to decide for themselves, and some put that requirement on themselves, others not. But again, I don't consider any of this done. We have 18 years of a process. So even if you're in a state where it's not required, go advocate that they change it. So I don't accept any policy as the policy that we have to live with. So if you want to advocate for transparency, get in there and go advocate and say we should have more transparency for this. And that's a state process. I think that's easily changeable if a group comes together with enough voices.
I really appreciate both of you reminding us that, there is time. We're just beginning here, and individuals can still make a difference. I'm going back to the how to find out more information, a really concrete question. If we get to Googling, if an individual this is where a national availability of all the information in one place would be helpful. But in the absence of that, if somebody wanted to get to Googling for their state, what are the exact terms that one might look for to help to find this information?
Actually, while we've been talking,
go on.
I do have one resource that's going to save you some Googling. Now, while we were talking, something did come to mind that I am going to pop into chat. I think I can send a chat to everyone, right? Yes, I can. There is one thing that will save everybody a little bit here. So I popped into chat, and I know that we can distribute it later, possibly build it into the slide deck. That Vital Strategies has done actually a really good state-by-state guide, and it will give you the link to your state page for your opioid settlement. So for those that aren't sort of in commute and are at their computers, if you hop into chat, you can follow that link and find your state.
Very helpful. Thank you. I also want to add that, for folks who are interested in getting involved through APA for some of this, we do have in the Q&A, the chat, there's questions. One of the Q&A does have the advocacy at psych.org website that can help with advocating on this issue. And so what's nice is there is, as Dr. Solarnik pointed out, there is a network of state and regional government relations that is available to help guide on this topic within the APA. Let's see here. I'm just trying to coordinate here on the time. I'm going to ask this question. So we're looking at this 18, keeping in the theme of the 18 years. With some of the cases still being appealed or halted in the legal system, how does that play out for states that have already distributed money? Could the money be pulled back or must it be paid back? And again, noting that we have 18 years for this to play out, where do you see this fitting in?
Yeah, I can take that one and then give it to Tara. They're not going to pull back money. We may just not get all of the money that was initially coming, like Mallinckrodt, which is now in its second bankruptcy. And the court is probably going to allow them to go from 1.7 billion to 0.7 billion. but the first wave of settlement has already been paid. And I don't think legally anyone can pull back money that's already been paid. I think that would be perhaps criminal. I'm not sure. So it's more that some companies, and by the way, Purdue wants to settle. Purdue wants to settle. It's the courts and the folks involved in the lawsuits that want them to have more, perhaps civil liability down the road. Tara, do you want to comment on that?
Yeah, so all of the places that things are still pending, none of that money has been handed out. So what it means on a tangible level is all that stuff that's unsettled, that money has not come to the state yet. So what will happen is once it's settled, there'll be some additional money that will come to the states and then potentially down to the counties. So what it means on a practical level at the county level is they always just keep getting extra money handed to them at the bank when these things get settled out. So it's a little weird if you're at the county level, you just like keep getting additional money in your bank in unpredictable times as things get settled out. But it isn't, nobody's handing money out to the state or to the county until everything's done. So that's not what's happening. So I don't want anyone to feel like anything is going to get pulled back. It's more that it just means like you're just going to someday get some additional money but you can't predict when it will be. Makes budgeting a little weird, or planning a little weird, but it's like an extra surprise you didn't expect a little bit. And I saw a lot of questions in chat. So the Vital Strategies link that I put in the general webinar chat, you go find your state. And once you've found your state's content, you can use that link to find all the grants that might be coming out if they are doing it in a grant format. One thing I would just want to make this really clear because I think this is confusing. If the state is giving money to counties, like in my example from North Carolina, where 85% of the money is going down to the counties, then you actually have to go to the county level. And a lot of the counties are giving out grants. So it's like, you have to monitor what the state's doing. And then if you live in a county, you got to monitor what the county's doing. So there's a lot of monitoring you have to sort of do. But so pay attention to what your state's doing and where you live. In terms of if you're trying to track what funding might be coming out. If you live in a state where a lot of the money went down to the county. So read the profile on your state from the Vital Strategies, understand where the money's going. And that's how I would be tracking what is going on. And then use that Vital Strategies to understand at the state level, that's where you find where the meetings are.
And to piggyback on that, when we went to the stakeholders meeting with the Department of Drug and Alcohol Programs, we were asking for some of the opioid settlement funds to be used from the state, not the counties. That 15% that's sitting with the state, it's still a nice amount and could be used to fund addiction psychiatry slots.
Wonderful. These were excellent answers and excellent questions from the attendees. I'm very, I'm hopeful about people feeling re-energized and re-educated on the topic so that they can go out in their states and communities and make a difference. To close, I would love to flip to the last slide, which has additional resources. Thank you again for putting in that resource into the chat there. But these are additional resources. The slides will be made available after this presentation, and they will be sent to the registered email as a follow-up. I want to thank our panelists for their insights, as well as the attendees for their questions, and any unanswered questions will help us inform future discussions on this topic, because this is going to be a longstanding topic. Behind the scenes, I would love to thank Brooke Trainham from the APA and Michelle Durst from AAAP, who have been instrumental in helping to orchestrate this discussion today. We so appreciated all of your questions and participation today, and we'll move together as a community in different states and different locations to really make an impact on a very important public health issue. Thank you again.